Goals. Setting goals and striving to reach them is what sports is all about. Whether your goal is the Olympic Games, simple good health and fitness, or something in between, one of the most important elements of your quest is injury prevention, or at least quick and successful treatment of injuries. In the field of sports medicine, massage is one of the most effective tools known for preventing and treating injuries. These are the healing hands of Rich Fay's mother, Louise. Her 27 years in the healing arts combined with Rich's 16 to give him the benefit of 43 years of massage experience and training. A registered deep muscle therapist and graduate of dozens of classes and workshops on the many elements of massage for sports and fitness, Rich often takes time away from his active practice to lecture throughout the U.S. and Canada. His book, Athletic Massage, is now in the third printing and still going strong. Alberto Salazar ran the fastest first marathon in history and followed it up a year later with an incredible world record. He is, however, probably best loved by his hometown fans in Eugene, Oregon, for the rain-drenched duel with Henry Rono, 9 days before Salazar's 1984 Boston Marathon victory.
Rich Fay was the masseur in Eugene that had worked the most with athletes. He was an ex-athlete himself. And Dick Brown, who was the administrator of Athletics West at the time, he decided to give Rich a trial run. So he sent Tom Byers and myself over to Rich Fay, and just with the idea of having us try him for a month and see how well it worked out for us. And after a month, we were so pleased with the massage we got from Rich. So we gave him our approval, and after that, Dick started having all the athletes work with Rich, and Rich was hired full-time to work for Athletics West. And we really found that he really helped us a lot. He helped us primarily in two ways. One was in recovery from workouts. We found that we were able to recover faster from hard workouts so that we could run another hard workout sooner than we used to be able to. And as a result, we got in better shape and our performances got better. And the other thing that really helped us was that we seemed to not get as many injuries. We no longer had those little nagging injuries, a sore Achilles or something like that, which might develop into a major injury. It seemed like we were able to cut or nip those injuries in the bud before they became something really serious. And when you did get injured, we felt like we were able to recover faster, because a lot of times when you get injured, you start to compensate for it and you end up coming down with other injuries. And Rich was not only able to work on the root cause of the major injury, but he was able to keep all those other minor injuries due to compensation from springing up. So overall, I really feel that massage is probably one of the most important parts of my training when I'm training full-time.
The 1987 Pan American heptathlon gold medal went home with Cindy Greiner. Veteran of 2 American World Championship teams, Cindy also finished an impressive 4th in the '84 Olympics.
With my variety of events that I do, I often get little tiny injuries that can really blow up into big injuries. And if I go in and see him right away, and usually he slides me right in, it seems like the injuries never really form unless, there's some reason I can't get in to see him, and then I keep training and they just get worse and worse. So whenever I have any kind of injury, I try to get in there right away. So I really trust him even more than the doctor, because he knows how all my muscles feel, and he works on so many athletes that he can really understand, what's a healthy muscle and what's not.
Massage is perhaps as old as man himself. It has only been recently, however, that the knowledge of massage techniques has progressed to the point where massage can be effectively used in the areas of sports and fitness. We have a number of special people that are going to be helping me with my demonstration today in looking at a variety of massage techniques that are each used for a specific therapeutic purpose. The first of these special people is here with me now. This is Cindy Greiner, and she is going to help me overview the massage techniques we'll be using today. Cindy, can we have you turn over, please? The first technique we'll examine today is transverse friction massage. Transverse friction massage moves not only muscles, but tendons and other forms of connective tissue to and fro across the grain of their fiber. Now, if an athlete has a muscle strain where muscle fibers have separated from one another, light transverse friction massage can be used to flush fluids out of the area which keep the tissues separated from one another. and can be used to actually spin the fibers closer together to one another, so that the scar tissue which forms only between the fibers as they lay in their proper space. If this does not happen, and scar tissue forms as a massive lump between tissues that have remained separated during the healing process, the scarring will be weak, and it will be irritating, and the athlete will have problems with that area from now until forever. So, if we know that an athlete has a strain because to stretch the area it hurts them and to heat the area increases swelling, we will massage the area lightly to and fro. Now, in cases where there's a vast amount of discoloration and the tearing has been severe, we have a condition that's known as a hematoma. In those cases, we want to hold off on the transverse massage until we have a physician's approval to go ahead and use the techniques. But in cases of light strains where only a small indentation or a small amount of fluid can be felt, we follow these basic rules. First of all, we never massage past the point of pain. If we move the tissues to and fro gently enough to only spin the fibers back together and flush the fluids out, no pain will be elicited from the person that we're working on. However, if we're working too deeply and forcing the tissues too far apart from one another, we can actually increase the amount of damage that has already occurred in the muscle. Take your fingertips with no oil on the skin. And in fact, if the skin is sweaty, you want to wipe it down with a little alcohol because we want a good deal of friction here.